Hi guys, I'm Alanya Tashon, and today I'm going to be covering what is most likely going to be covered in your maternity nursing class and what is 99.99% going to be on your exams. Before we jump right into this video, I'm going to need you to give me a thumbs up to let me know that you like this content, and go ahead and click the subscribe button and click the notification bell so that you don't miss any of my new uploads. So just to jump right into it, I'm going to be talking about maternity nursing. This class covers the prenatal period, pregnancy, labor and delivery, postpartum, and the newborn phase. I know there's a lot of nursing students who are like, this class is going to be terrible because I don't even want to be a L&D nurse. I don't want to go into any of that. I don't even want to be newborn. No. But everybody has to take it, so you might as well make an A while you're in the class. There's a lot of content covered in this one course. What I'm going to be telling you is those key highlight things that are basically 100% going to be on your test, because these are the things that they ask you about on NCLEX. And just to be honest, this is the major focus of things that you need to know if you do decide to go into maternity nursing. The first thing that I'm going to say before I go into the key topics that you should definitely know and review in this class is to please take advantage of practice NCLEX questions. Take advantage of the questions that are especially, of course, in the maternity topic, because these questions are most likely going to be seen again on your exams, because this is a very focused course. So a lot of the things that they're going to ask you in those practice questions that you may find online or in an access code that you may have on a book are the things that they're going to ask you about on your exams, because they don't have a broad range of things to ask you about, like a med-surg class or like a community class, because it's so specialized and so focused. You're going to definitely see those questions again, so take advantage of them. As an overarching statement, I would say anything that has stages, anything that has a special name or sign such as Chadwick sign, anything that has a acronym such as Gtpal or APGAR, know those things because they are super important and they will be on the test. So no acronyms, no stages, no signs and things like that. Now, to be more specific of what you need to know for your maternity nursing exams, the first test will most likely be on the prenatal period. So the signs of pregnancy, the female reproductive system, how the menstrual cycle works, the NAEGEL'S rule, all of those things. Within the female reproductive system, some of the things that you may need to know are things like the length of a normal menstrual cycle, the abnormalities of a menstrual cycle, the normal things of a menstrual cycle. You may need to know the pelvic shapes, the ones that are good for labor and the ones that are not good for labor. Definitely know about fertilization and implantation. They may ask you things like, where does fertilization occur and where does implantation occur, or where should it occur? Because we know that you can have things called an ectopic pregnancy, but that's a complication and I will be talking about those later. But remember that fertilization occurs in the fallopian tube. That's something that trips up a lot of people, so just remember that. As far as signs of pregnancy, there are categories such as presumptive, probable, and positive signs of pregnancy. Definitely know examples of those, because they may ask which of these is a probable sign of pregnancy and may have a list of presumptive and positive, and one of them is going to be the probable one. Definitely know those. You should know the function of the umbilical cord and the placenta within the pregnant woman. Definitely know the development of the fetus week by week, especially those milestone weeks, such as when the baby starts to move or when the baby is in the right position for delivery. As far as the Gtpal, like I was talking about earlier, you will 100%, this is not probably, this is 100%, you're going to have a question that says a woman is coming into the clinic or whatever, and she has had 3 preterm births. She has 2 living children, and she is currently pregnant at 37 weeks. So for that woman, you will have to put numbers for Gtpal, which is an acronym that stands for gravida, para, term, abort, and living children. Again, you will be given a scenario with a woman who's had so many things, and you will have to put the numbers that corresponds with Gtpal. Remember that. The second thing that I know will 100% be on one of your exams is the NAEGEL'S rule, which is the rule to determine the about time that the baby's due date will be. And for this, you'll be given a scenario that says a woman's menstrual cycle began on this date. And for NAEGEL'S rule, you will have to subtract 3 months from the first day of her period, add 7 days, and then add 1 year, and you will have the estimated date of birth for the child. For example, if it was April 1st, 2019, you would subtract 3 from April, which would be January. You would add 7 to 1, which would be 8, and then you would add 1 to 2019, which would be 2020. Why can I not add 1? Your answer will be January 8th, 2020 for the estimated date of birth for the child. Moving on, some other things that you will need to know are some tests, some diagnostics, some procedures. Like, you need to know basically what they do, when you can do them, and how they work. So examples of this are the non-stress test and the non-stress test and the contraction stress test. That is a mouthful. Contraction stress test. You need to know what's the difference between the two and what's a good reading for both and a bad reading for both, because sometimes they compare the two and ask you to differentiate. I know they definitely did that for me. The next session that you will need to know about, which I think for us was a whole separate exam, are the complications of pregnancy and the complications of labor and delivery. You will definitely need to know about placenta previa and the different types and the different locations of the placenta. You'll definitely need to know about prolapse cord and what to do for this. Remember to just keep the baby off of the cord for, as long as possible, because that's when they're getting the blood flow, and they will not get any blood flow if they are on the umbilical cord. So I remember that because, yeah. Anyway, you need to know about abruptio placentae, you need to know about hyperemesis gravidarum, and so on and so forth. So make sure any major complications of labor and delivery, of pregnancy, preeclampsia, definitely, I can't believe I forgot to say that, preeclampsia, HELP syndrome going into eclampsia. Know all of those things, know the ins and outs of what is happening, know what to do, know what medications to give. Definitely remember magnesium sulfate. If I did not tell you any other medication, remember magnesium sulfate. Also remember Pitocin and what that does. Those are the main 2 medications that I can remember were on pretty much like every test. Remember vaccinations that need to be given. RH compatibility is very important. For stages of labor, if you want a separate video that's straight up just about the stages of labor and what occurs during those stages, then feel free to comment that below. Remember the amount of time that usually occurs between the stages, and know the cervical dilation and effacement. Remember the definition of true labor versus false labor. There'll probably be a question on that. How do you know what true labor is? And it's cervical dilation along with contractions. So that is how you know it is true labor. Fetal monitoring and decelerations is super, 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 super important. Your professor may even put a fetal monitoring strip on the test and tell you to determine, what type of deceleration this is. My professors told me to remember veal chop, which is very helpful for me. Veal chop helped me to know what deceleration matched with what type of thing on the monitoring strip. I'll put a little figure somewhere on here so you can see what I'm talking about. I might even do a separate video on that. So if you want a separate video on fetal monitoring, just put it down in the comments. As far as postpartum, it is important to know what is normal and what is not normal. So know the normal amount of blood, the normal lochia, how it should look, how it should present. Know the fundal height and how it goes back down into the pelvis. You will hear fundus a lot in this class. Fundus, fundus, fundus. If you didn't know what a fundus was before, you're going to definitely know what a fundus is after this class. APGAR scoring is going to be important. They may put a scenario of the baby is crying, the baby is pink, warm to touch, da-da-da-da-da. What is the APGAR score for this child? And you'll have to add up the score and select your answer. Vital signs for a newborn is definitely not the same as vital signs for us. So know the normal parameters of vital signs for a newborn. Also know the complications that the newborn may have, such as broken bones or jaundice or cleft palate or anything like that. And once you've talked about the newborn, you are pretty much done with the class. The newborn phase was the last exam that I had in maternity nursing. So all of these things that I've talked about are very just broad concepts, but those are the major things that we talked about in maternity. If you would like to see more in detail about any of the things that I talked about, don't forget to leave it down in the comments below. Hit the subscribe button, hit the notification bell, and I will see you guys next time. Bye.